There are so many disabled and abnormal persons around us. Some of them can't walk properly. Even some of them can't stand up straight. Many of them have small or big foot. If any kind of patients have this kind of conditions, then they are called pathological gait patients. Hello everyone, I am Prince, Department of Prosthetics and Orthopedics. Today I am going to talk about what is pathological gait. So let's go. What is pathological gait? To know pathological gait, we have to know what is gait. Gait is a pattern of movement during walking, and pathological gait is the abnormality during walking when a person walks. So let's see some abnormalities in practical. The patient bends the trunk to the supporting side. Here possible causes are hip wheel pain because hip abductor muscles are weakness. Here has wide walking base and unequal leg length. Because of the hip abductor weakness, the hip can't be abducted, so the patient moves laterally for support. Posterior trunk bending. The patient is in hyperextended position or the trunk will move backward. Because of the hip extensor muscle weakness, the hip can't be extended, so the patient moves posteriorly for the support. The lumbar curvature exaggerated during walking for support the body, so hip can't be extended. Because of the hip extensor weakness, the hip can be extended. Here the lumbar goes forward and the trunk goes backward for support during walking. Circumduction. The limb follows a laterally curved path or swing outward. Possible causes can be involved relatively longer and hip flexor weakness. Because of the hip flexor weakness, the hip can be flexed. Here the patient lifts the pelvis on the swinging side. Here the hamstring muscle is weak. For the weakness of hamstring muscle, the knee cannot be flexed or knee will be in extended position. In vaulting, patient increases the vertical displacement of the center of gravity by exaggerated plantar flexion of the stance phase. The swing phase is relatively longer. This foot increases the vertical displacement and this foot is in plantar flexion position. The foot fails to clear the floor and it will be in plantar flexion and the foot drops to the floor in an uncontrolled slapping. Possible causes can be dorsiflexor weakness and plantar flexor spasticity. You can see in the video that the patient sliding his foot, suddenly the foot slapped to the floor. In hemiplegic gait, hip in extended position, abduction and medial rotation will happen. Knee will be in extend and ankle is in plantar flexion in inversion position. You can see in the video that the hand is like in the downside and the foot rotates in the medial side and the patient will walk like this. One leg crosses directly over the other, like crossing the blades of a scissor. Here, the knee will be in flexed position because of the genovalgum. In excessive medial foot contact, the patient bears excessive weight on the medial foot border of the foot. That means the weight of the body bears by his medial line of the foot. In lateral foot contact, the patient bears his weight on the lateral border of the foot. For different kind of patients, there are different kinds of treatments. These treatments are given by an orthotist. An orthotist is a certified by national authority and competitive course on prosthetics and orthotics subject. For the different kind of patients, they give different kinds of supportive device or orthosis devices. Only CRP has this professional in Bangladesh. And wise men said that service to suffer is service to God. I hope this video is helpful for you all. Thanks for watching and share this video if anyone wants to know about this kind of process or orthotics devices or anyone have this condition. Goodbye for today.